Hollander, a craniofacial surgeon with Mobile Oral and Facial Surgery. Thanks so much for being with us.
Thanks for having me, Devin.
All right, we're talking about virtual surgical planning, and this is not something that's just done during the coronavirus pandemic. This is something you utilize all the time. So what exactly is this?
Yeah, it's virtual surgical planning. I know it's kind of a mouthful there. Is a great way for us as care providers to utilize technology to custom fabricate things to help guide us during surgery to get a better outcome for the patient, if that makes sense. It's meant to be utilized to get better results for our patients.
Right, and I know that you do a lot of surgeries on skulls, and you're going to demonstrate in just a moment how this virtual surgical planning can really come into play. But you were telling me you actually do this for even more common surgeries as well.
We do. So at Oral and Facial Surgery, we utilize it for dental implants, for corrective jaw surgeries, and then also for various types of craniofacial reconstructive procedures as well.
All right, so tell us exactly what you're holding and how this all comes into play when we're mapping out the surgery on the computer before you even cut into the patient.
Yeah, so this is an example of a child who was born with something called craniosynostosis that affects the normal development of a child's skull. Prior to virtual surgical planning, we would go into the operating room, make cuts in the bone, and then reconstruct things in a more symmetric and normalized fashion, if that makes sense. But with the virtual planning, I can use the CT, the CAT scan imaging, upload it on a computer with a software engineer, and do the surgery virtually. And then with that information, I can reconstruct the skull in a more normal and symmetric fashion, and then utilize guides to take to the operating room to make those precise cuts and the reconstruction. So it saves a lot of time. I get a more precise outcome, and it helps overall with the patient.
Right. Okay. Yeah. Well, I know that many of you may have questions for Dr. Wallander, and he can answer them on a variety of topics, including craniofacial surgery, cleft palate, cleft lip, wisdom teeth. Do you do some of that too, even just regular oral surgery as well?
I do that as well.
Okay, so we can talk about dental implants, anything you want to talk about on Facebook Live when it comes to virtual surgical planning. And he's going to be joining us at 12:35, so go ahead and log on, get your questions ready, and I'll ask them to Dr. Wallander. Thanks so much for being our guest today.
Thank you, Devin.